care for young children and adolescents is an important part of preserving their oral health and ensuring a lifelong smile. Seeing a pediatric dentist early can set your child up for success by preventing cavities and discomfort later on. So, when should your child start seeing the dentist? Dr. Lorra, Cantú, Lindsey, and Debbie Solis, the new patient coordinator at AOMS Pediatric Dentistry, are here today to talk about scheduling that first dental appointment for your kiddos. All right, so Doc, take us through. What's the age? What are we looking at?
Ideally, we would like to see children come in after the eruption of their first tooth, which is usually about 6 months, and at the latest by the age of 1.
So they don't have a lot of teeth at that point, right?
No, they don't.
But I mean, it's important to kind of start getting those routines established and educating parents too, right?
This is actually a very important visit because this is the time we use to educate parents on preventative measures, on do's and don'ts about diet, and try and establish a good routine dental care so that we can prevent cavities and catch them early.
So let's talk about those diet things, Debbie. You can kind of take us through. What are things that parents may not know of the littles as far as diet goes?
We have a lot of problems with milk, milk bottles, not just the bottle, but the sippy cup. People believe that once they've gotten their child on the sippy cup, everything is good. It's not the apparatus that the liquid's, but it's the liquid itself.
So you have to be careful. I hear a lot of parents giving juice to kids when they head to bed. That's kind of a no-no, isn't it?
Yes.
Got to make sure about, and it is an educational thing for the kiddos, but also for the parents, how long to brush, et cetera, and things like that, right?
Yes.
Okay, so in that first dental exam, what are you going to do? What does that look like for parents?
At this visit, Debbie will come introduce herself, get them back, and we have a very child-friendly environment. We have lots of rooms. All the rooms have different themes. They have different toys, and we get to meet them, find out their medical history, their dental concerns, and we usually will perform an exam. Now, if they're 4 and under, we usually have them sit with their parents, and we will show them our mirror, show them our light, our flashlight, and kind of do a nice thorough exam, and then we will paint some fluoride varnish on their teeth. And that's a preventative measure. It helps, remineralize teeth that might have some weak areas. And they also get a toothbrush, goodie bag with a prize and a sticker.
More than anything, isn't it about kind of making that first experience a positive one, so you have a lifelong positive image of going to the dentist?
Yes, and that is our goal. We want them to have the best first experience they can at the dental office. We really, when we have to see a child who's in pain, usually that's going to require some treatment, and that's not the most ideal setting for a child to get introduced to the dental.
Makes a lot of sense, for sure.
Yes.
Okay, so if people want to make an appointment with you guys, they just need to call your office?
Yes.
You're accepting patients and everything like that?
Yes, of course.
Yes, and we do have our website as well.
Okay.
With a lot of information.
And I love the website. The AOMS website is so fantastic. Lots of great videos and resources for parents as well.
Thank you so much.
Ladies, thanks for coming by. We appreciate you. It was
Thank
good
you
to have
so
you in.
much.
All right, coming up next, we are going to head into the kitchen with our